is April Fool's Day, but we don't want you to be fooled by common misconceptions about your health any day of the year. So Dr. Philip Dixon with Cone Health Reedsville Primary Care is here to debunk some common health myths to help us all along on our health and wellness journey. All right, so we're going to tackle it one by one. Myth number one, you only need a primary care provider when you're sick or you have a chronic condition.
Not true, Tanya. We certainly see plenty of sick patients, patients with chronic medical conditions, but I think just as equally important part of our job is seeing patients that just need a partner on their wellness journeys, patients that just want to stay up to date on health screenings. So I think just in general, patients at all ages, all stages of life need a primary care provider. And that could be just an annual checkup to make sure that you're up to date on your vaccinations or age-appropriate cancer screenings, or you just want to have a conversation about strategies to work on things like weight loss. So no, we're here for everyone, not just those that are sick or with chronic conditions.
Yeah, you hate to go to the doctor only when you're sick. You want to go there to hopefully prevent something from happening to you, right?
Absolutely.
All right, so if someone doesn't have a primary care provider or may be new to the area, they're looking for one, how do they get set up with one? Because so often you're hearing, oh, we don't take new patients.
Great question. So Cone Health makes it really easy. If you just go to conehealth.com, right in the middle of the screen, you're going to see a big button that says make an appointment. And you can filter that search to your area, look at different practice options, different provider options, and schedule an appointment right away.
Okay, so here's myth number two. The myth is if I can't get to a doctor's office, I'm just out of options. And that happens often during flu season, allergy season.
Absolutely, and sometimes in those cases, we don't want you to come in the office necessarily because we don't want those diseases to be spread to other patients. So to that point, we really strive to meet patients where they are. Telemedicine is a growing entity, and I see patients virtually multiple times a day. I had 3 today, for an example. We really, and that could be like for a young mother that has young children that she doesn't necessarily want to bring into a doctor's office. We can address her concerns through a video visit. Cone Health also has mobile health clinics that are throughout the community. You can find a schedule when those mobile clinics are going to be in your community at conehealth.com. So no, absolutely you can see a provider without just coming into a doctor's office.
Which is fantastic when you don't have to get out of your pajamas to talk to the doctor, and you get whatever you need, and then you can, then go back and take a nap, and all of it is taken care of without even going. All right, myth number 3. Heart disease doesn't run in my family, so I don't really need to be concerned about my heart health. Why is that a myth?
Well, 80% of heart disease is actually preventable. It has nothing to do with your genetics. And really, to that point, you have to focus on your cardiovascular risk factors, and those are modifiable things like, if you smoke cigarettes, quit smoking. If you're overweight, if you're obese, working on weight loss. If you have hypertension, high blood pressure, making sure that's under control. If you're a diabetic, making sure your diabetes is under good control. So it's really doing things that you can to prevent ever having something like a stroke, heart attack, thing of that nature. So while your family history can contribute to your risk of, a heart attack, a large part of it has to do with other risk factors and not just your family history.
What you eat, whether you exercise or not, all of those kinds of things. Okay, so myth number 4, exercise has to be at high intensity to get any kind of health benefit.
Not true. There is a committee that provides national guidelines for exercise, and they recommend at least 150 minutes, between 150 and 300 minutes of moderate intensity exercise on a weekly basis. What does moderate intensity mean? Examples they provide are things like a brisk walk, fast dancing. I generally just say something that gets your heart rate up. And to that point, I also say, I don't necessarily care what you do. I just care that you're doing something. They also recommend at least 2 days a week of strength training. So things like light weights, because that can be beneficial to your health as well. So you do not just have to go out and run 3 miles in order to get benefits to your health. That's what I often tell people, because people are like, well, I've got, arthritis. I can't go out and run. I can't go out and walk. Get in a pool. That takes a lot of stress off your joints. If you like to dance, I have one patient that goes to line dancing classes every week. That's a great way to exercise. It doesn't have to just be, again, running or something that's high intensity, if you will.
Right, not what you normally think of. There's lots of different ways to exercise. All right, we're going to tackle a few more myths coming up right after the break. We'll see you in just a few more minutes.